Hello. Before we start today's episode, I need to ask you something. Have you eaten junk food this week? Had a drink or two? Stayed up late staring at your phone? Then this episode is not optional for you. Because right now, as you're listening to this, your liver might be working overtime, silently, with zero complaints. Until one day, it can't. Today, on the Pace Hospitals podcast, we're talking about the organ that never gets enough credit, your liver. And with me is Dr. Govind Verma, interventional gastroenterologist and hepatologist, having more than 30 years of experience in treating all types of liver diseases at Pace Hospitals. Welcome, Doctor.
Thank you, and I want to start at the beginning that whatever you mentioned just now, it's actually a reality for millions of Indians right now. The liver is most overworked and ignored organ of human body, as we all know.
Doctor, most people only think about the liver when they hear jaundice or alcohol damage. Why should a 28-year-old with no bad habits even be worried?
That's exactly the dangerous assumption we all have. As we all know, liver performs 500 odd functions. It helps you in building the proteins for your body to survive. It stores energy. It breaks down every medicine which you take, every food additives, every preservatives, that all is taken care by the liver silently. When the liver fails, your body collapses. And what's more alarming in India right now is that more than 10 million Indians are suffering from a disease called as metabolic associated steatotic liver disease, a silent killer. We are also seeing it in young adults, teenagers, and even in children who are not involved in alcohol consumption. They just have poor diet, sedentary lifestyle, stress, and obesity.
So, fatty liver isn't just an alcoholic problem anymore.
Absolutely not. In fact, India today is witnessing fatty liver related disease of liver more common than alcoholic related liver disease. What I meant is that the percentage of patients who are coming to liver specialist because of fatty liver related disease, metabolic associated liver disease, is on rise as compared to alcoholic related liver disease. And this tragedy is that there is no symptom patient has when they are suffering from metabolic associated liver disease. It's a silent disease. And what helps us is that we have to be aware of this liver health. And how does it help? On 19th April, on World Liver Day, we have a theme: strong liver, solid habits, or solid habits and strong liver, which makes your liver function 24/7 and you survive longer.
Doctor, you said no symptoms, but are there any clues, even subtle ones, that our listeners should watch for?
Yes, most of them are asymptomatic, but those who have subtle symptoms, they can be one of the following. Like number one, patient may have persistent fatigue. Number two, bloating after meals or indigestion. Number three, mild yellowishness of eyes or high colored urine. Number four, dark color urine, a kind of Coca-Cola color urine without change in your diet. Number five, unexplained weight gain, especially the truncal or belly obesity, and feeling of general weakness.
Doctor, five signs, and honestly, I've experienced at least two of those and just blame them on work stress. Doctor, at what point does someone need to actually see a liver specialist?
The moment you experience two of these five symptoms which I just mentioned, and that lasts for more than 2 weeks, get your liver checked. And how do you do that? Just get a liver function test done and an ultrasound of abdomen, which predominantly covers all the organs, but more importantly, liver. It costs hardly anything.
You mentioned an epidemic. How bad is the situation in India right now?
So India has one of the highest burdens of liver disease in the world. Almost 20% of the global liver disease burden is from India, and 10 million of Indian population is suffering from a condition called as cirrhosis, an advanced fibrosis and scarring of the liver, leading to liver failure of liver function, and ultimately liver cancer. As we also witnessed, as we are moving towards 21st century, that number of patients with liver cancer are on rise in India, And what worries me a lot is not the percentage of patients suffering from cirrhosis, but young professionals and entrepreneurs and students. They all are coming in their 30s and 40s with advanced liver failure and liver disease. And most important is that most of the people ignore their symptoms, or they are not aware of their symptoms, or they are asymptomatic. Most of the patients, when they do not have symptoms, obviously it goes unnoticed. But what worries me as a liver specialist is that when they have symptoms, they ignore it for the social stigmata reason, their personal lifestyle exposure, and so on, and they silently come up with the advanced liver disease. And that is where we all are supposed to understand. When you diagnose the patients with liver disease early in the event, then we can definitely halt the further prognosis, and we can stop the advancement of a liver disease to cirrhosis and liver cancer. So awareness is the key here, and we want to bring with this podcast to give you an liver awareness, liver health awareness. How can you diagnose liver disease early in the course of liver failure, rather than waiting for an advanced liver disease and cirrhosis and liver cancer. So get yourself checked by doing a liver function test and so on.
That's terrifying. And preventable?
Fatty liver actually is the initial diagnosis with which patients come to our liver clinic. And the best part of the fatty liver is that it's completely reversible, 100% reversible, provided we check in time and we start treatment early in the course of the disease. If you ignore the tickling alarm clock, then you will have an advancement of the fatty liver to steatosis and cirrhosis, and ultimately leading to liver failure or cancer. So it's very important to understand liver has an extraordinary ability to regenerate and heal. So if at all you give chance to liver in time, it will again come back to normal and it will perform again all liver functions.
Okay, doctor, our listeners are probably a little scared right now, which is good. But let's give them something actionable. What can someone do starting today to protect the liver?
5 things, simple, practical, no gym membership required. Number 1, cut ultra processed foods. Packaged snacks, instant noodles, biscuits with long shelf lives. All these contain trans fats and additives to your liver. Liver has to process these all foods constantly, and please give it a break. Number 2, reduce refined sugars. This is big one. Excess sugar converts directly to fat in the liver. Sugary drinks, fruit juices from pockets, mithai every day, your liver is storing all of that as a fat. Number 3, stay hydrated. Water helps flush toxins. 6 to 8 glasses of water one must drink additionally per day, not cola or juices, only water. Number 4, move your body. It has been clearly mentioned right from the beginning, every 30 minutes of walk per day for 5 days a week helps liver store fat reduce significantly. It may not reduce your weight, but it will reduce the fat accumulation in the liver. That is how it helps. So no need of running marathon. Simply walking, dancing, cycling, swimming, any of these 10 to 30 minutes of a day for 5 days a week would do the work. Number 5, get tested. Simple ultrasound of abdomen and a blood panel which consists of liver function test. Get it done in the morning in a fasting state, and I think that tells you everything about the liver health. You should know your numbers here as well.
Doctor, what about turmeric, amla, all the liver detox products people are buying online?
Haldi does have some hepatoprotective actions and properties. Yeah, it's genuine. But about the replacements and supplements, I don't think lifestyle can be replaced by the supplements or alternative medications. We all know detox market in India is largely unregulated and it is on rise. Some of these products contain herbal compounds that actually can stress the liver and can damage the liver. We have been witnessing time and again many patients coming with liver failure because of the overuse of these compounds, quote unquote. And as I would say, as a doctor, I would request you to consult your doctor and liver specialist and not influencer.
Doctor, let me ask the uncomfortable question. How much alcohol is too much for the liver? Because a lot of our audience are social drinkers.
There is no safe limit for everyone, especially for Indian population. As we know that in India, social drinking is sometimes only social, but most of the times it crosses the clinical threshold without people even realizing it. And that's why I wouldn't say there is any safe limit for anyone, because liver metabolism usually it's individual, and what I can tell you is that daily consumption of alcohol in small amounts, even in small amounts, over a period of time may cross that threshold and lead to liver disease. So, quote unquote, I think there is no safe limit for alcohol, especially in Indian population I am referring to. And then liver gets only one chance. As we know that if you have a heart disease, you will get some symptoms like chest pain, breathlessness, and so on, but liver actually silently scars inside. And there are no symptoms at all unless you develop cirrhosis in almost 25% of the patients, which is actually a significant liver damage is already done. So my suggestion is better be aware of and get your liver checkup done. If at all you drink so-called safe limit alcohol intake you take, please get your liver checkup done. It's not negotiable.
Doctor, if you could leave our listeners with one single message on World Liver Day, what would it be?
Your liver has been working for you silently every single day of your life. Never complain. What can you do for making it live longer? As you all know, 2 million lives are lost every year for liver disease, and 1.5 billion people are suffering from chronic liver disease all over world. What you can do is you have to follow the theme for World Liver Health Day, that is solid habits, strong liver. The backbone of this is that regular physical activity, balanced diet, stopping or avoiding alcohol. Most important is regular health checkups. Now, what can you do? You can give 30 minutes of your time once in a year if you are not a regular alcoholic. I would say that a regular health checkup which covers ultrasound of abdomen and liver function test would do magic for you for knowing your liver health. You will have a healthier and longer life. If you protect your liver, liver will bounce it back to you in terms of giving a longer life. It's a silent soldier. A performer needs a respect and needs care. The one who doesn't complain needs more attention. Focus today before it's too late.
Beautifully said. Dr. Govind Verma, thank you for this conversation and for probably saving some lives today. Listeners, if this episode made you stop and think, please share it with one person. Not for likes, not for views, for their health. You could be the reason someone catches their liver disease early. Stay healthy, stay active. Make solid habits, including maintaining healthy weight, eating a balanced diet, reducing ultra-processed food and sugar, staying physically active, avoiding or reducing alcohol consumption, and scheduling regular liver screenings. It encourages reducing risk of liver diseases. Thank you for being with us.